In a swift rejoinder, our county COVID-19 emergency response team managed to trace all the contacts. Before the country-wide lockdown was lifted, our public health officials, together with the law enforcers, had managed to screen over 300,000 passengers at our main border points in Mulot, Chebilat, Poito, Masese, and Darajasita. To aid in contact tracing, we introduced simplified personal travel booklets where passengers log in their names, travel routes, departures and arrival times, and vehicle registration numbers. The booklets also contain information on COVID-19. We have distributed over 200,000 of these booklets to the residents of Bomet through past stage managers, border representatives, and community health volunteers. We have also engaged Seaward Vocational Training Center to produce face masks. We are targeting 1 million, and so far we have produced and distributed over 200 face masks to the residents of Bomet. Konoin Technical Training Institute, which is just a kilometer from here, has also got a nod from the Kenya Bureau of Standards to manufacture hand sanitizers. I acknowledge the Kenya Red Cross Society for their continued humanitarian support and capacity building activities. They have enhanced community health strategy by training over 1,000 community health volunteers. These volunteers play a critical role in detecting and reporting cases in our community, sensitizing the community, and offering home-based care for the COVID-19 cases. Over 700 health workers, media professionals, and hoteliers have also been trained ever since the first case was announced. We are also grateful to our partners, among them the Equity Group Foundation, James Findlay's, DIP, the World Vision, Pata Kenya, Imarisha Sacco, the Lake Victoria South Water Works Service Development Agency, and all our development partners for joining us in the fight against the current pandemic crisis. Through the support from the national government, we have also received 4,710 PPEs, comprising of surgical gowns, gloves, surgical masks, face shields, and so forth. Asanteni sana for that support. Thank you so much. We have identified 22 secondary schools as quarantine sites, out of which 4 are active and can be used as need arises. The sites are equipped with basic requirements such as bedding, mattresses, utensils, and basins. The county enforcement and police officers are assigned to ensure security of clients and school property. Some hotels have also been assessed and identified for healthcare workers as per the guideline issued by the Ministry of Health on healthcare workers' welfare. Based on the guidelines on isolation and the need to maximize the minimal resources, including human resource, the County Department of Public Health and Medical Services has identified 4 isolation and holding centers, namely Longiza County Referral Hospital, Kawiyua, where we are standing, Sub-County Hospital, Tenwek Mission Hospital, and Kablong St. Clair Mission Hospital. To support management of COVID-19 patients, the county has equipped the isolation facilities with piped oxygen at Koyua and Longisa isolation units, procured oxygen concentrators, cylinders, nebulizers, laundry machine, and standby generators. Patient flow adjustments were done to fit isolation requirements. Initially, the county had 105 beds in 4 facilities: Longisa, Tenwek Hospital, Koyua, and St. Clair Kablong Hospital isolation site. But now, we have expanded the bed capacity by establishing an additional 200 at Koyua, which has been commissioned today. Bomet now officially joins the list of counties that have made the government minimum requirement of 300 bed capacity, which we have exceeded. It is important to note that this facility will still be useful even in post-COVID era, because we will upgrade it into a permanent structure, the way the foundation was done, and the supporting pillars on the wallings and even the roofing, it was done. We will just remove the tents and construct using bricks and put mapatis. We also have ICU beds in Tenmek and our main referral hospital, that is Longisa. And of course, we have mentioned that we have 2 moving ICUs in the form of our 2 ambulances. Through our County Public Service Board, we have recruited 191 healthcare workers, unit under UIC program. The staff have been posted to various health facilities. Additionally, the county has recruited, this is our own arrangement, has recruited 82 healthcare workers to give support services at the isolation sites. I thank the national government for posting medical officers, pharmacists, and ICU nurses to Bomet County. Thank you so much for doing that. We have also adopted innovative measures in managing our health issues, among them operationalizing the County Health Management Information System at Longisa County Referral Hospital. It is important to note that Bomet was the first county to adopt the COVID-19 resource management and reporting software from the UK-based Elevant Connect, a clinic health care system. The tool has enabled the registration of 141 health facilities and over 100 community health units, giving the officers on the ground the ability to conveniently submit data on COVID-19 related activities in their areas on real time. Our health management teams now have access to real-time reports. We endeavor to register all the 246 community health units with this software. We continue to improve access to primary health care through construction and equipment of dispensaries in all the sub-locations, including expansion of existing inpatient, theater, and diagnostic services. We have plans to progressively improve the number and capacity of health care workers in order to match with the increasing need of specialized services. In consultation with all the stakeholders, we intend to support and strengthen the community strategy by supporting the community health volunteers. Through the Bomet County Food Support Program, together with the national government and the Kenya Red Cross Society, we supported over 10,000 vulnerable households with 90 kgs pack of maize, each to ease the economic hardships caused by the effect of COVID-19. As of yesterday, the cumulative number of positive cases in the county is 126. The cumulative number of cases in home-based care was 63, 57 have been discharged, and 6 are still on home-based care. The cumulative number of cases in isolation is also 63, which are a coincidence, where 49 have been discharged and 5 are still in isolation. Sadly, we have lost 9 lives to this disease ever since it was first reported in the county. I take this opportunity to sincerely appreciate our diligent and dedicated healthcare workers, not only in Bomet, but in the entire Republic and the world over, for their hard work during the COVID-19 period. The government remains committed towards ensuring safety for our health workers and their well-being. Finally, I urge the members of the public to adhere to the Ministry of Health guidelines and the national and county government directives, such as regular hand washing with soap, keeping physical distance, obeying curfew orders, avoiding crowded places, and handshaking to protect themselves from this disease. Stay safe. With these few remarks, it is now my pleasure to invite our CAS to address the public. Karibu sana Mheshimiwa.
Thank you very much, Your Excellency, and your entire county leadership, the dedicated healthcare workers in the county, Ladies and gentlemen, members of the Fourth Estate, good afternoon and welcome to our daily COVID-19 briefing that we have the pleasure this time around to deliver this briefing from this beautiful place and this county. Your Excellency, as you said earlier, and I want to say that the Cabinet Secretary sends his greetings to the people of Bomet, and he has also apologized for not being able to visit this county during the time that he was on our tour. But we are here to redeem ourselves, and I am glad to hear that our redemption has been granted. My team and I are extremely happy to be here with you today, to be in this great agricultural county of Bomet. My being here is part of the county visits that I have been conducting countrywide to assess the level of preparedness as pertains to the coronavirus disease or COVID-19. As I said earlier, this visit was meant to have taken place about a month or so ago, but due to circumstances beyond our control, it was postponed at the last minute. Please accept our apologies, and we are here to repay that debt. Before I proceed, I want to thank the people of Bomet County, led by Governor Dr. Hilary Barchok, present here, for the warm welcome they have accorded us and the great reception that they have presented to us. Asanteni sana Kongoi. At the same time, please accept our sincere condolences and sympathies following the death of your predecessor, Governor, the late Honorable Dr. Joyce Laboso, from whom you have been able to take over the leadership after her unexpected demise in July last year. And it's now exactly a year and 1 month since this very energetic lady left us to be with the Lord. It is unfortunate that she was not able to achieve her full desires and aspirations for the people of Bomet, but we believe in you, Dr. Hilary Barchok, that you are moving this forward and will realize her aspirations. However, we believe Governor Barchok, following in Honorable Laboso's footsteps, has been able to stay on the course in terms of ensuring the people of Bomet enjoy the services that his predecessor so much yearned for this great county of Bomet. May her soul continue to rest in eternal peace. The coronavirus disease has destroyed the lives of many families and a lot of people. Since this disease struck our country, it has rendered many people jobless and has forced the government to close down our learning institutions and kept our children at home. This, as you know, is not something that is unique to us here in Kenya, but it is a global reaction to the COVID-19 pandemic. I want to believe Bomet County is not also an exception to this disruption caused by COVID-19 pandemic. It is my sincere hope that the measures that have been put in place have been well explained to the people of Bomet and that they are strictly adhering to them. According to our data, and perhaps you may have much more current data than us, Bomet County is at number 22 out of the 47 counties. It ranks number 22 with respect to the number of COVID positive cases. It has so far recorded 126 people confirmed to be positive for COVID-19. There is need to enhance our efforts and to make sure that this disease does not spread further within the county. To the people of Bomet County, and indeed to all across the country, I want to remind you that this disease does not have a cure so far. Therefore, I want to plead with you. The only way to curtail the spread of the virus is to regularly wash your hands with soap and water, wear face masks at all times when in public places, maintain social and physical distancing, and avoid all forms of gatherings, be they social or political. These are containment measures that are our only weapon against this deadly virus. I am duly informed that the county has identified 22 secondary schools as quarantine centers, out of which 4 are already active and can be used as and when the need arises. The quarantine sites have been equipped with basic requirements such as beddings, mattresses, utensils, and basins. At the same time, some hotels have been assessed and identified for use as quarantine facilities for healthcare workers. I am also informed that isolation and holding sites have been identified across the county at Longisa County Referral Hospital I Unit, this facility, Koiwa Sub-County Hospital, Tenwek Mission Hospital, and Kaplong St. Clair's Mission Hospital. The county has equipped the isolation facilities to support management of COVID-19 patients. And we can speak for what we have seen today because we were earlier at Tenwek and we have been here with you and we have witnessed the work that the county has achieved during this time. The work that has been done includes piping of oxygen at Koiwa and Longisa Isolation Unit, procurement of oxygen concentrators, cylinders, and nebulizers, amongst others. And we heard the governor tell us that they have met the 300-bed capacity, and I want to congratulate the county for meeting this irreducible minimum. Availability of ICU equipment has been a major challenge to many of the counties. In Bomet, I think you have about 9 ICU beds, 6 in Tenwek and 3 at Longisa Referral Hospital, but this may have changed between the time we had these figures and now. You have also mentioned the moving ICUs that you have, which we witnessed, and we think that those ambulances are very useful in this pandemic response, and having 2 of them, I think you have done quite a bit in acquiring them. In terms of recruitment, the County Public Service Board has recruited 191 healthcare workers under the Universal Health Coverage Program. These healthcare workers have been posted to various health facilities in the county. And again, Your Excellency, you also mentioned that the county itself has managed to recruit some support healthcare workers. The virus is now spreading everywhere in all the 47 counties. This is because we have established local community transmission of the disease. It is no longer being imported from outside the county. 34,117, which is 98% of the 34,705 confirmed cases in the country, are local transmissions. It is for this reason that His Excellency the President directed that all counties must raise their level of preparedness by ensuring that they put up a 300-bed capacity in readiness for any eventuality that might arise from this pandemic. I want to appeal to all the counties that may not have attained this requirement to strive to do so, and at the earliest possible time, instead of waiting to be caught flat-footed. This could cost a lot of lives. When the coronavirus disease struck our country in mid-March this year, it completely altered our way of life. We have now been forced to adopt a new normal. These are just but a few of the challenges our country is going through. And Bomet County is no exception. I am sure the people here in Bomet have been forced to change their lifestyles. Their livelihoods have been affected adversely, and this is something that we are very aware of, and it is happening throughout the country. It's a challenge that we are all in, and we must strive to curtail the spread of the virus so that we can move towards resumption of normality as soon as possible. Each and every one of us must take personal and individual responsibility in fighting the virus. And this is through adhering to the containment measures that we have advocated all along. Secondly, there must be concerted effort by the county governments to ramp up measures to further curtail the spread of the virus. And together we shall overcome this disease. During our tour today in Bomet, I think we have witnessed the work that the county is pleased to see the progress, the initiative, and even the innovations that the county has put in place in this COVID response. Again, Your Excellency, I want to congratulate you for this work and the people of Bomet that you have carried out. At the same time, you have kept the numbers of positives in Bomet is still low. I urge you to continue to observe these measures, because when it is low, it is possible to contain this spread. And when it is low, it is possible to do contact tracing, identifying and treating when the numbers are low. You can be in control. When the numbers rise and community transmission sets itself up in the community, then it becomes quite a challenge to be able to do contact tracing and many of the other activities to try to contain the virus. So please do not lower your effort or your guard, and continue as though you are preparing for the worst. Fellow Kenyans, turning to the COVID-19 statistics for today, we have, over the 24 hours, tested 4,178 samples, of which 179 have turned positive, bringing the number of tests that we have conducted so far to 34,884. The number of positives that we have identified in the country to 34,884. The number of tests that we have conducted, cumulative number of tests, stand at 467,677. So that's where we are today, 34,884 positive cases in the country. Of these cases, 162 are Kenyans and 17 are foreigners. The youngest is a 1-year-old child, the oldest is 75. 126 are males, 53 are females. The distribution by counties is as follows in descending order of the numbers of positives. Nairobi, as usual, leads the pack with 66 cases. Garissa with 21, Turkana 12, Nakuru 12, Busia 11, Taita Taveta 10, Kiambu 9, Kitui 6, Kisumu 5, Kajiado 3, Machakos 3, Kericho 3, Nyamira 3, Trans Nzoia 3, Kisii 2, Mombasa, Laikipia, and Nyeri 2 each, Kilifi, Baringo, Muranga, and Uasin Gishu 1-1. Your Excellency, I note that Bomet is not included among those that have reported a positive over the past 24 hours. In terms of sub-county distribution, I will run through the top 3 counties. Nairobi at 66 cases, had 8 in Westlands, 7 in Kibra and Langata. East Embakasi, Embakasi South and Kasarani, 5 each. Dagoretti North, Dagoretti South, Kamkunji and Starehe had 4 cases each. Embakasi North, Embakasi West and Roysambu had 3 cases each. Ruaraka 2 cases. Embakasi Central and Makadara had 1 case each. Over these past 24 hours, Garissa has also stepped in to be number 2 for the past 24 hours, recording 21 cases. 11 of these are from Dadaab refugee camp, 7 from Garissa town, and 3 from Fafi. Turkana, with 12 cases, had 11 from Turkana West and 1 from Loima. And the 12 cases in Nakuru are from Nakuru East and Nakuru West, 5 each, Gilgil and Naivasha, 1 each. Busia at the border continues to record cases. They had 11 cases, 9 in Matayos and Teso North 2. The rest of the breakdown is in this document which the press will receive at the end of this brief. I am delighted to inform you that 415 patients have recovered from the disease. 161 from the home-based care program and 254 discharged from various health facilities where they were receiving care. The total number of recoveries that we have registered so far is 21,059. And we take opportunity here to thank our healthcare workers, frontline healthcare workers, all the healthcare workers in the country for the wonderful job that they are doing in this fight against COVID-19. Thank you very much. We also do lose patients now and then, and we are sad to note that we lost 4 patients to the disease over the last 24 hours, bringing our fatalities to 589. And again, we want to send our deepest condolences to the family and friends of those who lost their loved ones. As I conclude, once again, I want to thank the people of Bomet, led by your governor, Honorable Dr. Hilary Barchok, for according me and my team a warm welcome and a wonderful time with you for the day. Once again, I say asante sana.
Time for questions. We have members of the press here who want to ask questions.
Sana. Shukran sana. Mimi nafahamika kama Martin Kosgei kutoka runinga ya Citizen TV. Ningekuwa na baadhi ya maswali hapa ningependa kuuliza. Ya kwanza ni kuhusu wale maafisa wa PHOs. Wengi wamekuwa wakifanya kazi kwenye contract na wamekuwa wakifanya kazi hasa katika janga la corona, wakifanya maneno ya contact tracing, wakishughulika katika mazishi, lakini wanadai kwamba bado hawajapata allowances kama maafisa wa afya ambao wanahudumu kama contract. Swala la pili ni kuhusu swala la mazishi. zile PPEs ambazo wale maafisa wa afya wanavaa, je, ni familia inagharimia kulipa au ni serikali inalipa? Swala la pili, kuna zile familia ambao pia hawapendi kuona maafisa hawa wakitekeleza mazishi nyumbani kwao. Je, usalama wa maafisa hawa inatolewa na wao wenyewe wanajifaa kujikinga au serikali pia inafaa kuwapatia ile security? Swali la tatu ni kuhusu innovations. Kuna wale vijana ambao wametoa various innovations kama kutengeneza sanitizers ambazo zimeweza kupitishwa na KEBS. Kama serikali mnachukua jitihada gani hasa kuwasaidia? Shukran.
Okay, asante sana kwa hiyo swala Bwana Martin.
Yes. Okay, my name is Gilbert Kimutai from the Standard newspaper, and my question is regards a collection of samples by the ministry from surveillance. How does I just need an expoundment on how the ministry collect samples through surveillance. Where does this happen and how does it happen? Thank you.
Okay, okay, let me
I have one question, Your Excellency. I represent all the radio callers, and I have two questions. Number one, if we now compare those, the infection and those who recover, where are we? Are we on a better position to improve? Then secondly, initially we have been hearing of Mombasa in the list, and currently we don't see Mombasa. Do we borrow a leaf from what they did so that they behave normally, not abnormally? Thank you, sir.
Okay, thank you. I will start with the last question and respond to that. And I think that is the message that we have been expounding all along, is that these are abnormal times and we need to do what we have to do. We have to behave in the appropriate way to be able to curb the spread of this virus. The virus spreads from person to person through interactions, through gatherings, to those activities that we have said we need to minimize. So Mombasa, yes, initially was one of the hotspots. In fact, it was the leading county for quite a while. Recall that we had to put in a lockdown measure for a particular constituency of Old Town in Mombasa for almost a month. And we are now seeing that Mombasa cases are not rising as they were before. It is a good sign for us. Whether it is happening in Mombasa or any other place, that is the intention of the measures that we have put in place, is to really ensure that as a country we begin to see our numbers coming down eventually. And I think all of us can attain that in any county. We need to continue to observe those measures, implement those measures, and enforce those measures in some cases. And we will get there. Your other question was, where are we as a country in terms of these numbers? We have recorded almost the number I talked about today, over 34,000 or so far, over the last 6 months. We follow our numbers very carefully. We look at the trends. We analyze this data. We have scientists and others who support us in looking at this data and sometimes even predicting how we are moving. I think what we are seeing now after all these months is that we seem to be moving into a good area. I'm not going to say where we are on the so-called curve, whether we have flattened it or going down, but we are moving in a good direction if we continue to maintain what we are doing and are very careful. So we are at a good place. Definitely when we compare our history of this infection in the country, we compare it to other countries, especially those in the Western world, we are much better off where we are in terms of numbers. And that is something that has been observed in several countries in sub-Saharan Africa. The trajectory of the disease, it seems to be different in Africa, sub-Saharan Africa than in other countries. That does not mean that that curve can change in a bad direction at any time, and that is what we want to avoid. We don't want it to change into a bad direction. We need to continue to do what we are doing so that we keep pushing it and our numbers keep reducing, and we hope that we at some point can move to a situation of normality by being able to lift in a progressive way. As we follow these numbers in a very progressive and careful way, we lift some of these measures until we eventually come to normal. And that is what every country is aspiring to do in their response. Gilbert Kimutai, you needed some information about how we do surveillance samples. The samples that we collect are samples that in the initial stages, most of the samples come from the process of surveillance and contact tracing. So in Bomet today, if you have somebody who is found to be positive in a village somewhere, there is an entire team that is responsible for now following up on the movements and the contacts of that individual, the family, and people whom they have interacted with, the entire network of people who might have interacted with this COVID case, so that we can be able to identify them and then test them, if necessary, quarantine them or isolate them. If they progress from isolation, they go for treatment. That is the premise of containing an epidemic. But also part of the testing is to test, targeted testing. You test certain areas where you feel that there may be some level of transmission of the disease, and you can determine this from the trend of your test. What your results are showing you. They might show you that certain areas are looking not very good in terms of the numbers of positive coming from there. Then we go in and we might do some level of targeted testing to get a better feel and idea of what's happening in those places. We have done several of those in many places. In Nairobi, which was remained to be the epicenter, we have gone to various of these communities and done this kind of testing. So over 400,000 tests we have conducted so far, and that is how we work. Okay. And to add to that, our testing has occasionally been limited because we require reagents that are imported from outside the country, reagents that are in high demand in almost all countries of the world, that we have to compete for and get those supplies so that we can do this testing. So on occasion, we have issues with the supply chain, but so far we have been able to obtain these reagents to attain that 400,000 tests. And we will continue as we move forward to do what we can to ramp up the level of testing that we do. Bwana Martin, uliuliza mambo ya public health officers ambapo wako kwa contract ambapo hawajalipwa. Hayo ni maneno labda nafikiri kila county inaweza kujibu vile watu wake, manake public health officers ni watu wa county, si ndio bwana governor? Yeah, lakini nafikiri mambo hiyo bila shaka inaangaliwa na kila county na mambo zao itamalizwa. In terms of deaths, makifo, ulisema nani analipa hiyo gharama ya PPE? Tukiwa serikali tumesema hii COVID-19 response serikali inafanya ile inaweza ikabea hiyo costs ya watu ambapo wanatibiwa, wale wakifa, kupelekwa mahali pa kuzikwa na hizo zote hizo protective gear. That is something that our teams do. our response teams, and there are special response teams that have been set up in every county that deal with burial issues. They are equipped with these things, and they go and do the necessary and bury the body, having provided their own equipment. You are now telling me that there are some situations where the families of the dead are being asked to pay for the PPEs. That's, I think, the message I got from you. I don't know about that, and perhaps I think the DG might be able to shed some light on that. But as far as we know, our teams, both in the counties and at our national level, these rapid response teams that go in and guide the burial come fully equipped with their gear. They help the family to do the final rites, and then they move away. So we are not aware of this situation that you have brought to our attention. In terms of innovations and what is the government doing, one, as a government, any government should encourage its people to be creative, to be innovative, and to develop local solutions to problems that we face. This COVID-19, I think, has, in a way, also spurred us as Kenyans to think and to see how we can respond to it. So we are very glad when we see our young people coming up with innovations that are supporting this COVID response. Those innovations can be pushed further, yes, you're right, but there are certain procedures that need to be followed, and I think those procedures are fairly clear on how innovations can be carried forward to commercialize them so that they are available for use. If those procedures are not clear to the young people who are doing it, there are agencies that do.
Matthew 25:34. Then the king will say to those on his right hand,